Hi, I'm Dr. Mark Student, and today we're going to talk about wellness, documentation, and diagnosing. We're really going to dig into what it's doing either for you or to you and to the chiropractic profession. Let's go to the slides and we'll get into further detail. So, we're going to be talking about diagnosing, demonstrative documentation, triaging. We're going to talk about all the fun things we need to do about getting paid and advancing chiropractic. And it's really important and it's a problem. So before we get started, I know towards the end everybody wants to run. Take your phone out, take a picture of my contact information. There's a QR code if you want to learn more about us. But I'm more than happy to have a conversation with you, to have an email conversation with you. Whenever you need, it's my pleasure if it helps chiropractic. So, documentation is about three things: reimbursement, which affects your income; compliance, which can cost you your money, your license, or your freedom; and your reputation, which has to do with referrals. Even wellness has to do with all three of those things. Because if you do something wrong in the insurance world, the patients complain to the carriers and they make a financial calculation if they should investigate you. But cash patients in a wellness scenario only have one place to go. That's your licensure board. They go right to the board at the state level, and by law, virtually every state is mandated to have an investigation. And they're brutal. They're short on resources, so they like to make examples often. The fines are steep. They suspend licenses. They do a lot of different things, and if they feel you're hurting someone, it's a significant issue. So you've got to be really, really careful about your documentation. Now, what we do in the Academy of Chiropractic, we make it easy. Your documentation should be incredibly easy, and it's not hard. It really isn't, because when I onboard a new consulting client, the first thing we do is a full compliance review. We look at documentation, and we are awfully concerned with those living in the wellness world. And now we've got those Chiro, like doc in the boxes, the Chiros for a cheap fee. Come right in, get adjustment and leave, no appointment necessary. We're starting to see problems all over the place, especially in the malpractice arena. We're seeing issues. It should be easy. Now, here is how horrible documentation destroys your practice and the chiropractic profession. A lawyer sent this to me. Actually, when I wrote it was today. It was 3 days ago. As part of an ongoing case. It was a record sent by a chiropractor. As the chiropractor also had no identifying information on this document, this lawyer sent it to his lawyer friends, and he's going to bring it to the local bar association meeting next week or next month as the joke of the month. But the punchline is, look at what all chiropractors do. Look at this documentation. This was sent to me by a chiropractor. It was a personal injury case. The chiropractor did not touch the patient. He did not do personal injury. It was wellness, but this was part of his records, and the patient had seen him in the past. Now the lawyer gets this, and this is the crap this doctor sends out. Because you see, what happens is when a medical doctor makes a stupid mistake like this, oh, that MD says he's an idiot. But when a chiropractor makes that mistake, all of chiropractic is no good. And that's an issue. So by sending documents out, you've got to be careful. And actually, I'm in New York, and in New York, they enacted a law a few years ago, a regulation, because an infant in the neonate unit was supposed to give zero point 0.3 milligrams of potassium, and they gave 3 milligrams. They couldn't see the decimal point, and the baby died. So it's actually a licensure violation, and to not have legible notes, amongst other things. Now, if we look at how wellness documentation destroys your practice profession, let's take a really good look at this document. Okay? So if we look at this document, I'm sorry, I was scrolling around, I apologize. There's a lot of elements in here. And the first thing I want you to notice is there's no S for subjective. There's nothing. Well, we're going to talk about that in a little bit. But there's no S for subjective, and we'll get to that. But understand there was 152 wellness visits over 8 years. There was one initial evaluation, and this was it. Okay? So, and by the way, if I'm turning my head, I'm working on multiple monitors, reading off a different screen. His subjective. John saw treatment today complaining of a frequent aching discomfort in the low back. He rated the intensity of discomfort using a VAS. I don't know if that's vas deferens or visual analog scale because there is no key for the acronyms. As a level 4 on a scale of 1 to 10. There's no such thing as a 1 to 10 scale. A visual analog scale is 0 to 10, so you've perjured yourself. The discomfort was reported to increase with movement, applied pressure, and prolonged sitting. The discomfort was reported to decrease with rest and movement. This is perfectly fine, other than the 1 to 10, to only treat the low back. It's a hard rule for every area you touch. You need a symptom, a clinical finding, and a diagnosis. But let's move on. Objective. Spinal restrictions or subluxation. The subluxation is not a clinical finding. It's a diagnostic conclusion. You can have motion palpation, aberrant movement, spasm, hyperemia, anything. Those are the components of what you're finding. And L3-4, so far we're consistent. Pain and tenderness, no pain reported or elicited. Well, no pain reported. He reported low back pain here. Posture analysis, short leg. Now muscle spasms in the lumbar area, which contradicts this. Range of motion, entire lumbar spine is within normal limits without pain noted, okay, during the range of motion. His assessment, there is no diagnosis here. Zippity doo-dah. Current status, asymptomatic. He's very symptomatic. This looks like this person just cut and paste from a last report, didn't even look. Complaints, no complaint presented. This is nonsense. You have complaints up here. Chiropractic manipulative therapy. I have a hard time using the word manipulation. It's not a philosophical issue. If you ever get pulled into court, doctor, are you a physical therapist? Are you an osteopath? They manipulate, you manipulate. It just takes that argument off the table. Just use a chiropractic spinal adjustment, and there is no argument. Primary treatment, okay, and following extra spinal regions. Well, where's the treatment order? You have to have a treatment order. This is an E&M visit. Management is the M. Where is the treatment plan? There is none. But it gets better. Okay? And I just highlighted everything that I just discussed. All of these things have to be talked about. And the word John. Doctor, do you have relations with John when you're done? And do you bat your eyelashes? You know, it sounds absurd, but, you know, Mr. Jones, only us demented chiropractors use familiar first name because it gives an air of prejudice that you're not talking about a patient objectively. And then here's a soap note, okay? First of all, subjective, and I'm not going to be able to explain this in depth. This forum does not allow us to. But we have primary spine care programs, and if you go to that QR code again, I'll show it again in the back. There are programs which can help you. You can elicit a response. Patient elicited, which is taught. I teach in 3 chiropractic colleges and 2 medical schools at various levels. You're eliciting a response. Patient had to run your hand down the spine, taut and tender fibers. Elicited a pain of scale of 1 out of 10, 2 out of 10. Subjective, muscle spasticity, hyperemia, whatever you want. Motion palpation, I don't care. Okay, that gives you that response. But this person, for 152 wellness visits, had the exact same thing. This was the only change. T2 left sacrum, and then they changed it here and here. Could be C1, C6, whatever it is. That changed over 152 visits. No other clinical findings, never a diagnosis. For every area you touch, you need a symptom, it can be elicited, a clinical finding, and a diagnosis. That is a hard rule. That could cost you your license. It could cost you your money. It could eventually cost you your freedom if you're doing it over patient after patient after patient, and you get involved in a criminal RICO case, or it might just be civil because you're using a paper instrument to defraud an insurance company if this is an insurance scenario or insurance patient. But it doesn't matter the financial class of the patient. Whether it's cash or insurance, it's the same documentation. It doesn't change. It doesn't change ever, ever, ever. So we just talked about this. For every region treated, you need a symptom, a clinical finding, and a diagnosis. Missing elements can cost you in cash patients licensure violations, fines, insurance fraud, or RICO under the Organized Racketeering Act for insurance. You've got to be real careful. So this patient, as I said a moment ago, was in a car crash at the end of the 8th year of wellness care. The lawyers issued a subpoena ducis tecum. Subpoena ducis tecum is an order for records, and that you have to, by law, submit that to the attorney, which I got. So why does a lawyer issue a subpoena ducis tecum to subpoena his records? It's easy: to distribute to all the plaintiff and defense experts. Once the lawyer has it, the plaintiff expert, which was me, gets a copy of this. But so does the defense experts. Now, in the beginning of every expert report, experts are required to list or put in the report how they derived at their conclusion. So the one that I did, here's my sample report. I had a list of radiologists, the hospital department, the neuroradiologist, the neurosurgeon, the primary care provider, another radiologist, a neurologist, an interventional pain management, a neurosurgeon, the chiropractor, and a PT. All of these people got a hold of the exact same notes. Every one of these people, every one, all 152 saw this, and this. All 152 records. So here's what the plaintiff lawyer said. Now I know why I'll never use a chiropractor. I no longer want their referrals because I'm stuck with them. Here's what the defense lawyer said. I love working with these people. They never use the word doctor, by the way, because I win almost every case with this typical type of documentation from Kairos. Typical. The primary care medical doctor wrote, what a joke. I don't care about the so-called reported outcomes. They look like failed therapists. The radiologist said not even an x-ray, and they had ridiculous findings. The neuroradiologist said myelopathic findings and no MRI. They probably don't even know what myelopathy is, which, by the way, is core compression with ensuing neurological deficit distal level of lesion. You need to know that like the back of the hand. I'm afraid these patients will get hurt. The pain management doctor said myelopathic findings and no MRI. This is scary and should be malpractice. This is why I refer to PTs. At least they don't hurt these patients. The neurologist, the neurosurgeon, and the second neurosurgeon said the same thing as the pain management doctor. And the head and neck surgeon, by the way, who's my cousin, he actually weighed in on this. He said, in the operating room, as I am opening for anterior approach fusions for the neurosurgeons, all the surgeons talk about is the chiropractors who should not be doctors, is they never diagnose correctly and hurt people. They always skip the process. Physical therapists love it because it's great for their referrals. So folks, here's the research. You ready? According to Blanchett in 2016, they found that chiropractors versus physical therapy on the occupational side, there's a 313% increased disability, secondary disability, when PT's the first provider versus chiropractic. There's a 239% full compensation or disability greater when PT is the first versus chiropractic. You know what all these doctors say? They don't care. They don't care. Why? A research soundbite does not overcome the evidence I see over and over in chiropractic's documentation. There are no shortcuts, folks. There's a reason why we're mired in a 7% utilization. Listen, it's about your reputation, the clinic's reputation. You want to shoot yourself between the eyes? I could care less. But it's about my profession's reputation. And we do live in a cancel culture. And it's just the way it is. And there's no trust. The rest of us who are doing it differently and have gone not just the extra mile, but the extra hundreds of miles and hours and days and weeks and years to get better, we're humiliated. We're just humiliated when we see stuff like I showed you, which unfortunately is more of the rule and not the exception. So we've got to be able to manage our reputation. And reputation management, it's the single most important piece of practice growth. It's what they think of you. I mean, my wife had cancer 3 times and she's doing great now. She had kidney cancer, but we had to find the right urologist, the kidney surgeon. And we went to the person, I went from Boston to New York to Philly to Washington, and I looked at these doctors' CVs, but I wanted the person with the best reputation. not what the best ad, or not what the other patient said. Um, that patient might have done great, but 10 others might have died. I want this doctor's reputation from other doctors. I want to look at their curriculum vitae. I want to look at what they've done. All reputation. We're in the reputation business. That drives your referrals. So I'm not interested in about how you feel about chiropractic. I can't change that. But if I change what you see, then you'll change how you feel. That's in relationships. I feel you take me for granted. The wife tells the husband, I don't. I feel dismissed. I feel transparent. Well, the husband said, I love you. I love you. The wife says, it doesn't matter. That's how I feel. You can't change that. All of a sudden, you're opening the door to the car when they get in the car. You hold the chair when they go sit. You hold their hand while you're walking. Now you're changing what they see, and it changes how you feel. We are no different. There are things we do, like in very basics, when you're documenting history. You have to do history of present illness, review of systems, past family social. Okay? I don't care if you're doing a 99202 and it's brief. You don't have to. Who do you need to make happy? If it's insurance to pay or for reimbursement, your licensure might want these things down. Patient care is important to understand these things. But collaborating MDs and referring lawyers, it's critical to really function at this level for everything. Listen, a neurologist does this. It's very brief. Past medical history, GERD, HLD, current meds, social history, medical records. This is typical of what you see, but for us, it's not enough. We're mired in 7% of utilization. And I know people say it's more. I challenge them to validate that. It went up to 10 at 1% at one point, but I think we're back in 7. It doesn't matter. Orthos, neuros, neurosurgeons, medical primaries, they're seeing 99% of the population. I want to tie into this, so I got to make them happy. And happy endings in our industry equals referrals. You make them happy, they refer. I can't change how you feel, only what you see. So when I do a report, and I just did a report for that attorney I talked about with the crappy records. When I tell you that I did a robust report, I delved into past medical history. I mean, like a starving man after a T-bone steak. I delved into it. I made sure I had a complete review of systems, everything. The lawyers said, I quote, I've never seen this complete a history before. What you wrote about past medical history changed my case. I will now get the entire policy, which is over $1 million more. Result, he's already referred 5 new cases to me in 2 weeks. And 2 of his lawyer colleagues called me to refer me more cases. I don't even have an office. He said to me, if you treated patients, I would close your practice out in a heartbeat. You would never have enough space because not only myself, but every attorney here, I would tell them only you, only you, only you. So I want to share with you, if you change what they see, you'll change how they feel. It's simple. This process of reputation management has also worked with doctors who've had licensure issues in the past, legal issues. We're talking about fraud felony. We're talking about battery. We're talking about a myriad of people who have served time. In fact, it's taken me about 2 years. We've rebuilt their reputation. We've done it through advanced credentials and other things. And all these doctors are now getting PI referrals from lawyers. So it could do that with you. Just give me a jingle and it's my pleasure to help you get through that. Simple, not hard. But this is the type of thing that you need to look at when you're doing allergies, meds, review of system, robust. How long does this take? No, or yes. Review of previous treatments, family, social, history, pre-existing. Every EMR system has this. On paper, which you shouldn't be. You should be in an EMR system because things should be typed. It's robust and it's easy. When you're doing things, by the way, follow the new E&M guidelines in 2021. I do not care if you're cash. The same guidelines, the same coding, the same everything. Okay? And remember, a 99203 is the same code as a 99214. I covered this in a previous slide, and I think I've got it covered. So, folks, listen. Take your phone out before we switch off of the screen. Take a picture if you need to contact me. It is my pleasure to share any of this information with you. Call anytime. And thank you, Cairo Secure, so much for giving me the platform to sharing this. Thank you and have a great day.